So we now know that using lights and sirens responding to the scene saves between 3 and 4 minutes, and it only results in clinical significant interventions at any point during EMS care, much less the 3 to 4 minutes we save, in less than 7% of patients. It's not a very high yield. Well, let's go back to Dr. Kupas and learn more about the position statement that he recently wrote with a bunch of other great folks that was signed off on by 14 different EMS organizations across the United States and Canada. And this is something really unique. It was signed off on by the National Association of EMTs, by the IAFF and IAFC, by physician organizations, NEMSP, ACEP, even our friends in Canada. Truly amazing thing when that many organizations in EMS can get together and agree on anything. Let's hear about the details from Dr. Kupas. Dr. Kupas, you are killing it on this podcast. Thank you so much for all of your help. Let's wrap up talking about a really important position statement that just came out. You were the primary author, and boy, talk about a who's who of people involved in EMS, a great list of co-authors. Why don't you tell us about this position statement on the use of light and siren?
Well, thank you very much there, Dr. Jarvis. I think that, this is a topic that has been a lifelong passion for me. The momentum behind this position statement is amazing. So this statement was put together and done by 14 agencies. It replaced a 1994 statement that was done by the National Association of EMS Physicians, one organization. These 14 associations include associations related to EMS, emergency medicine, quality, safety, and fire. And to get 14 organizations with that broad a focus, all agreeing on one thing, was pretty astounding. And I was very happy to be part of that with people from all of those other organizations. If you want to get a high-level summary of what that statement says, first of all, it says EMS, the purpose of EMS is to provide the highest quality healthcare and patient care to people that have emergencies or need healthcare in the out-of-hospital setting. And sometimes it is important to save a few minutes in getting to them because there's an emergency and it's justified to try to get there as quickly as you can. But it also says that, many times when the public calls us, it is not an emergency. As a matter of fact, we know that the vast majority of the calls are not for emergencies. We're doing more and more treat in place, more and more, many of them are refusals of treatment and don't even get transported, that sort of thing. And then many of the ones that do get transported certainly don't need minutes saved to make their outcome better. What are important if you're going to get to that point, though? You need data. Your system needs to closely track this as a quality parameter for what you do. And this is, lights and siren transport and lights and siren response rates are part of the NEMSQA, the National EMS Quality Alliance, which is one of the organizations that were in this. Those are two of their quality points that we should be tracking in every EMS agency. The other thing is that you need to have good emergency medical dispatch protocols. You need to have dispatch centers that understand the importance of this, that do call taking in a way that allows prioritization of calls. Some of that is use of specific EMD protocols, but then on top of that, you need a layer of prioritization of calls and matching the outcomes of those patients with those categories of calls with the response you expect in your community. You need medical direction and quality improvement from other EMS professionals within the agency to look at the data and make those determinations as to where that cut point should be and which calls justify lights and siren use and which ones don't, and other parts of the agency's lights and siren policies. And then you need the public to understand what is going on. We have a lot of misconceptions in EMS. We have the same misconceptions, I think, about what the public expects with lights and siren use. So we need to make sure that we're surveying the public, that we are working with members of our public, working with elected officials, so that they understand these changes that they're seeing if they're seeing less and less responses or transports with lights and siren. In many cases, they prefer that. And we all know that 911 centers get a lot of calls where the caller says, don't come with lights and siren. And then the other group, in addition to the public, which is sort of an extension of them, is the municipal governments. Municipal governments set things like contracts for EMS care within their municipality. And they need to understand the risks. They need to understand that when they set a contract that expects fast response time, they might actually be doing a disservice to people. They might be causing it to be unsafe. They might be causing their communities to be loud and noisy. They might be causing their EMS agencies to be racing to every call fast, but then not be able to prioritize and get to the cardiac arrest or the higher priority calls as quickly because they're racing to everything quickly. They're not prioritizing which ones are more important. And that's sort of, all of the nutshell of all the things that are in that position statement.
First off, thank you for that great summary. The position statement is so good. It really does hit on all of the things. Nice summary of time saved, of harm, of potential benefits. It says, yes, we're not trying to pry this out of your fingers. There is a use for it, but it's a medical intervention and it needs to be targeted. Like any medical intervention, we need to stop making policies at a policy level that encourages us to do things that are unsafe, much like the reason Domino's Pizza no longer has a get it in 10 minutes or it's free. That encouraged bad behavior. They recognize that. And it also talks about the involvement of so many agencies and the public. Great work here. Again, we'll put the link into our show notes. This is a wonderful thing. It's open access. Please take a look.
And I will tell you that one of the things that I think is a lot of people get this. A lot of people are open-minded. They see the overwhelming amount of studies and things that have been done over the last 30 years, all leaning in one direction, and they get it. But culture is tricky. Atul Gawande said something that I quote a lot now, and basically he says, culture is embedded. It is there to stay. It's deep. He said, culture strangles innovation in the crib. And, there are certainly reflexive, nope, this is the way we always did it. This is why we're in EMS. We have to get everywhere. The things that I've heard, on the flip side are often statements like, if it's your family member, or you try holding your breath for 42 seconds to 3.8 minutes, The point is, we have good ways of, with a lot of validity, identifying which calls need that savings of a couple minutes and which ones absolutely do not need the savings of a couple minutes, and we're putting people at risk. And, I think changing that culture is tricky, but EMS providers that work in systems where they respond to a quarter of their 911 calls with lights and siren and the other 75% without, or where they transport, all but less than 1% of their patients without lights and siren, they start doing it more and more and looking for ways to use it less. And they feel like they arrive at a scene. They are not, ramped up with adrenaline and rush into the house, and then, they're all pumped up, and now they have to, be that calm, caring person for the patient that's looking for somebody that's, a very competent, caring provider. It just sets a whole new thing. And when as we talk about burnout and that sort of thing, reducing the stress of the job is really important.
Great point. I love that extra point there. So much of this really is about our provider wellness in addition to our community wellness. Great point. And thank you again, Dr. Kupas.
You're welcome.
You've been listening to the EMS Lighthouse Project podcast, a proud member of the FlightBridge Ed podcast family and a Fire Dog production. Visit flightbridgeed.com for more information.